And you personally are convinced, I mean, you've been studying this since 1994, and you've been studying, you said, 3 or 4 hours a day, almost, and...
I've read everything I can get my hands on.
Have you ever come across anything that would indicate that maybe it's true, what they're putting their $140 billion chasing?
At first I thought it was true. There was an article in Reason magazine written in response to Peter Duesberg's challenge. And I read it. It was written by an MD from UCLA. So I tried to contact him to ask him some questions, and they told me at UCLA Medical School that he was no longer there. He had moved to, I think it was Salt Lake City. So I tried to track him down there, but I couldn't. But he gave Duesberg a pretty good challenge, but he didn't touch on the fact that Montagnier admitted that he couldn't find any retrovirus in the blood from these AIDS patients, and he couldn't purify whatever he found there. It was mostly cellular material. So you can't make an antibody test unless you can purify the virus, so you know what proteins you're looking for. As far as I'm concerned, all those HIV proteins that they use in those tests, they're all cellular proteins. And if you're sick, you're going to have more of them. If you've got the measles, you're going to test HIV positive. If you have the flu or a cold, depending on when you're tested, because the body produces antibodies to meet the challenge of the microbe, and when it overcomes the microbe, the level of antibodies falls off. So it depends on when you're tested. If you're tested at the height of an infection with mumps, you're almost certainly going to be HIV positive on both of those tests, because you got, if in a viral infection, you got cells that are being destroyed, and you got all these cellular proteins that are out there in the bloodstream.
So what would happen if somebody, I had mumps when I was probably 15 or 16. So let's say a boy, he's 16, 17, he gets mumps, goes to the hospital. Let's say it's a severe case, and for some reason, they decided to give him an HIV test, and he tests positive. What will the hospital basically now do with this person who all he has is the mumps, but for some unfortunate reason he took the HIV test and now the test says positive?
Okay.
What will now happen to this person?
There will be a conference. They will contact this person. If he's a minor, I guess they would contact his parents for an interview with the AIDS doctor. So they'd come in and they'd tell him that he tests HIV positive.
Now, is there an AIDS doctor in this town?
The last I knew there were 2 of them.
So it would be one of those 2 doctors that would be called to this situation.
Right. And then they would ask this boy, maybe they'd ask the parents to leave the room. Then they would ask this boy, they'd say, have you ever had unprotected sex? And if he did, then they'd say, you've got HIV infection.
If he ever had it. If he had unprotected sex, then they would just presume that that's how he got this positive testing.
Either with a man or a woman. It wouldn't make any difference according to the HIV AIDS theory.
But your understanding of AIDS, what is the likelihood that he actually would have picked up this HIV virus from having sex, heterosexually or even homosexually? What's the chance of him getting?
I don't think there are any statistics on the chance of getting HIV homosexually. But the statistics are out there on getting HIV from a partner heterosexually.
Which is basically what they've asked him. They've asked him, have you ever had unprotected sex with the opposite sex?
Yeah.
And if he did, they'd automatically believe.
They'd say, you've got the HIV infection.
That the positive testing was a result of having that unprotected sex.
Yes.
And what's your knowledge as far as what's the likelihood of anything transmitting from another sexual partner?
Well, in the largest study of its kind ever done any place in the world, it was conducted by Nancy Padian of University of California Biostatistics Department. I think she's an epidemiologist. She studied 175 couples where one had HIV, where one tested HIV positive and the other partner didn't. And these were monogamous couples. They weren't swingers at that stage. They followed them for 10 years, and not one HIV negative person became HIV positive from their partner.
And yet they're having sex, normal sexual relations.
Unprotected sex.
Having sex.
Well, some of them did. Some of them used condoms, and some didn't.
But many didn't.
Yeah, and I don't think there were any that used them all the time.
Okay.
The chances of a woman getting it from a man in that study were 1 in 1,000 per contact.
Mm-hmm.
And the chances of a man getting it from a woman were 8 times less.
Like 1 in 10,000.
Yeah, something like that.
Almost 1 in 10,000.
Yeah. Well, that doesn't sound like a sexually transmitted disease to me.
But the fear in most people's minds, if somebody has a one-night stand and goes off and has sex with this female at the bar, so to speak, and he finds out that she was HIV positive or had AIDS, as they would think.
Yeah.
He would think it was much greater than 1 out of 10,000 chance.
Yeah.
He'd be scared to death.
Oh, yeah. And he probably wouldn't be able to track her down anyway to be tested.
And what happens when somebody is told that they may be getting AIDS and they had sex with somebody that has AIDS? Don't they kind of almost get into a semi-shock?
Yeah, well, some of them commit suicide. Some of them, it destroys their lives.
Just by the knowledge that they had sex with somebody who had HIV positive, because they think they're going to get it now.
Yeah. This Matthew Shepard, the gay boy in
that was killed?
Laramie, Wyoming.
One that was killed.
Yeah, I think ABC did a program about them last week. I saw it.
Oh, another one. Okay.
And they were taking a new look at why Matthew Shepard was killed.
Really?
There's another possibility, yeah. Matthew Shepard was heavy into methamphetamines and other drugs, and so were these 2 guys that killed him.
Okay.
So some of the people out there think it had nothing to do with the fact that he was gay. These 2 guys picked him up in a bar and they were going to rob him.
Okay.
And they were, I think all 3 of them were strung out on crystal meth. So they robbed him, and I think they were saying that the one guy was so strung out, one of the robbers, one of the 2 guys who's in prison now, was so strung out on crystal meth that he started beating on him. And they had experts testify on the program that, yeah, crystal meth can do it. Your mind snaps and you just start,
Sure.
And that's why the Shepherd boy was killed. It was not because he was gay.
Right. So what you're saying is that there's the media push, and there's a worldwide push to somehow substantiate, to validate that the homosexual lifestyle is not sinful as such. I mean, what do you think is the real push here going on as far as...
Let me say one more thing about Matthew Shepard.
Okay.
He was told he's HIV positive.
Earlier.
Yeah.
Okay.
And that may have contributed to his drug use.
He kind of gave up. He didn't care.
Yeah. He felt he was going to die a horrible death. He knew that there are no drugs that cure HIV. And he probably snapped and thought, well, I'll go out in a haze.
So